Hey guys, thanks for the opportunity to be able to speak to you today about the very exciting new COVID vaccine. Just to give you a quick history for those that don't know me, a little bit about my background. I practice medicine here in the Twin Cities. I've been doing so for the last 20 years. My specialties have been orthopedics, geriatrics, and emergency medicine. I also was one of the state epidemiologists here in Minnesota for a period of time, and so worked with epidemiologists such as Mike Osterholm and others in the state for a number of years. Very interested about infectious disease, how it works, how it spreads, how it's prevented, how it's treated. Much of my career has involved these sorts of things. So COVID, for that matter, has always been an infectious disease has always been kind of an interest for me. Again, what a year we've had with COVID. I don't think we've ever seen an infection in our history that has had quite the morbidity, mortality that this has had, quite the global impact that this has had. And obviously there's so much that we don't know about it, chronicity, immune response, other sequelae, long-term effects, many things we don't know, but many things we're starting to learn. When we look at some of the numbers, they've been very impressive. U.S. COVID deaths to date have been around 320,000 and counting. In comparison, the flu in 2019 killed 34,000. Again, for comparison, lung cancer in 2019 killed 142,000. So COVID deaths have been way out, surpassed these other things that are common killers for us. Worldwide, COVID deaths have reached, again and counting, 1.7 million deaths worldwide. That's more deaths than any war that our world has seen. We're having single-day totals in the U.S. That are more deaths than we've seen in 9/11, so almost like having a 9/11 every day. As far as vaccinations, thinking about them in terms of medical interventions and advancements, when we think about how great vaccinations have been for us in general, one think tank kind of broke down the greatest interventions of lives saved for us as mankind, and they kind of listed them since inventions have been around. And I'll just give you an example of some of the top five, and there's a huge list. And again, I just want to give you a few of these just to give you some context of things that we have come up in medicine and technology that has really been an impact for mankind. Anesthesia is a good example, is one of the top ones. Invented in 1850, has been estimated to save 50 million lives. Pasteurization, invented in 1890, has saved some 250 million lives since its inception. Blood transfusions, invented in 1913, has saved 1 billion lives. Unbelievable. Antibiotics, invented in 1928, has saved some 200 million lives. And of course, vaccines. Invented in 1955, and this is pre-COVID vaccine, but since 1955, vaccines have saved 1 billion lives. Not hamburgers, we're talking lives. That's a lot of lives. You look at all the interventions since mankind, and it ranks in the top of all interventions and inventions that man has done that has saved lives. Very few things that we have invented have saved more lives than vaccines. With this context and this background, again, we've talked a little bit about the burden of COVID, and you guys know personally probably the burden of COVID, the global burden of it. So with this context of the background and the burden of disease, that's the context in which we introduce this vaccine. It comes at a much needed time, a time where we're seeing a lot of morbidity, mortality. Sometimes when I talk to people who are resistant to vaccines, a lot of times I think they don't remember the context that we just kind of spoke about. They don't remember their history. They don't remember living in a time, and they've not lived in a time pre-vaccine and what it was like with that kind of disability, that kind of death and mortality. Some facts that we know about this vaccine: there's other vaccines coming to the market, but the two that have been approved for emergency use have been the Pfizer and Moderna vaccines. Some people, they question the rapid way in which these have been approved. We obviously talk about emergency approval by the FDA. We should clarify, when we're talking about emergency approval, it just means we've cut some of the red tape, but does not mean that we've had any shortcuts on the scientific scrutiny of these medications, of these vaccinations. They've gone through all the rigor that any drug that has been FDA approved has gone through. They've been through the clinical trials, they've been through the lab testing, they've been through all the process. It's just been more expedited. You think about this, for what this has done, or the impact this has had globally, for scientists, this has been their Super Bowl. This has been their Nobel Prize. This has been their life's work, if you will, to try to come to market with this. So they've been extremely motivated, as the whole world has been extremely motivated to come up with a solution to this horrible disease. And that's part of the reason why we've been able to move so quickly in developing an effective vaccine. The fact that it's 95% effective is amazing. Again, looking at the morbidity and mortality that we've been dealing with, most of us would have been happy in the medical field with a 50% effectivity rate. But to be 95% effective is awesome. And again, in the process of making this, going through the emergency process, I want to emphasize there have been no shortcuts in the processing and the scientific rigor of which this has come to pass. One of the things that's really allowed us to make this development so quick and this vaccine so quick is the fact that some of this technology has already been worked on for years and has been waiting for such a time like this to be able to then reveal or use this technology. It's almost like they've been building the perfect vehicle all these years to deliver this vaccine. And that perfect vehicle, that new vehicle that has been used in this vaccine development is that vehicle of mRNA, or what we call messenger RNA. Vaccines in the past have had a slower development because we've used DNA, but with this system we've used mRNA. And messenger RNA allows us to develop proteins, specifically the spike protein, which is part of the coronavirus, and it's allowed us to develop a message in a protein to attack just the spike protein. So you don't get, with this messenger RNA development, you don't get the whole virus that's exposed, that your body's exposed to. You don't get the whole COVID virus. You just get the spike protein that's associated with coronavirus. Our body develops an antibody, a response to the spike protein, and therefore we have immunity. And again, the mRNA is a much quicker way to express this protein that our body can respond to. Normally, again, with vaccines, there's more steps involved. We have DNA process to mRNA to ribosomes to RNA, and then the protein is eventually expressed, and then antibodies develop to that. But in this situation, we've been able to go right from mRNA to development of the protein. And the way that our body develops proteins, it's a one-way street. It goes from mRNA to expression of the protein, but never goes back. That brings up some of the question that other people have had: can this virus or this vaccine then get into our DNA, alter our DNA, and therefore make us different people because it gets incorporated into our DNA? And scientifically, that's never happened. We've never been able to go from DNA to protein. That's always been the route. It's never from protein, mRNA, back into the DNA and back into the nucleus. mRNA cannot enter the nucleus, therefore cannot get into our DNA. So there's no way to kind of go backwards. It's only a kind of a frontwards or a one-way street to produce protein from mRNA, not backwards. So that's the uniqueness of why we've been able to develop this vaccine so quick and it's so effective. Other questions that people have had about the vaccine has been simply, will it will it trigger kind of other reactions or cause other diseases or side effects? And as far as we know, again, it's been very effective in the patients that we've seen. They've had little side effects. We've had some people that had allergic reactions. Again, those numbers have been small, but in all the clinical trials, the side effect profile has been very small and been similar to other vaccines that we've had. My last point would be really for you to consider risk versus benefit. And everything you do in life, and certainly everything you do in medicine, has this concept of there's a risk involved in the intervention or the medicine, and there's a benefit involved in the intervention or medicine. And when you think about things that we would not question for a second, for example, taking ibuprofen and NSAID, for example, it's over the counter. Most people don't think twice about it. A matter of fact, 30 million people take an NSAID daily. It's reported. But yet we look at even something as simple that we think is very benign as NSAIDs has a 2% chance of having life-threatening complications like a gastrointestinal bleed or a GI bleed. More than 500,000 people have a risk of this from taking an NSAID or ibuprofen. That's a pretty large number. There's a significant risk for kidney damage by taking something as simple as ibuprofen. And so really, you think about there's nothing that we do, and most of us wouldn't think twice about taking ibuprofen, but really there's nothing that we do that doesn't carry a risk with it. With that said, the risk of this vaccine of having an adverse event or adverse reaction or adverse side effect is very, 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 very low. The risk of infection, the risk of allergy, and other things are super low. Versus the benefit. Hopefully, the majority of the time you've listened, we've spent talking about the benefits of this medication in light of how much death and disability that we are seeing. The benefits should way outweigh any risk that is potentially posed by this vaccine. So hopefully you've been convinced, and hopefully you've now really see that the benefit far outweigh the risk for you personally. And if you really haven't been convinced personally, please think of others. We've said the whole time that this vaccine or this infection has been in our society that there's a risk of transmission with both asymptomatic and symptomatic carriers. There's a risk of transmission to vulnerable people who don't have the immune system to be able to fight infection and therefore have a very high risk of death. And so if you don't think about yourself, please think about others who may be affected by having this horrible infection. And lastly, if you don't think about yourself, if it's too risky for yourself and it's too risky and it doesn't really move you to care for others in that way, then think about your decision to be in healthcare. We're dealing with the vulnerable. We've decided to go into healthcare. We could have done lots of other things, but we decided to go into healthcare because we like to help people. We want to help people, and specifically seniors and those vulnerable. There's no better way to really show that you care for seniors and other people than to get yourself vaccinated. You reduce the transmission and likelihood then that you'll give it to that vulnerable person or that vulnerable adult. So please, see this vaccine for the blessing that it is. Don't be swayed by misinformation. This is a good development. No, it's a great development. Get vaccinated. Thanks.